Unlock the secrets of stroke recovery with me. Join my journey as a neuroperformance coach as we go through some of the highs and the lows of what post-stroke life looks like for patients. From the initial shock to the discharge after leaving the hospital, discover the unique rehabilitation exercises that are going to help guide you on a long-term path to recovery. Don't miss this vital insight into the world that's affecting upwards of 17 million individuals a year. Welcome. I'm Daniel Gallucci, neuroperformance coach, and I'm going to be your guide for unlocking your full potential when it comes to stroke recovery for your brain and your body. I have an extensive background in osteopathy, functional neurology, as well as clinical neuroscience and imaging. I've worked with everyone from elite athletes to military heroes recovering from life-changing events in their lives. Stroke is something that, again, has touched many folks that we know at one time or another, and I've witnessed the incredible level of resilience and recovery of the human spirit, as well as the biological tissue that is the brain. So today, let's delve into this transformative journey of stroke recovery and explore the cutting-edge neuroperformance rehabilitation strategies that can make a real difference. A stroke occurs when there's a disruption of the blood flow to the brain. It is 100% a medical emergency, something that needs to be seeking medical attention right away. You can usually group it into two main categories. One would be a hemorrhagic stroke, and that's when you've got a bleed. The other would be, and that's rare, that's probably about 13% of strokes globally out of the 17 million that occur a year. The much more common would be the ischemic stroke. That would be a blockage in blood flow, and that's happening, again, 87% of the time, or the majority of stroke that we see in the world today. And there's going to be an onset of symptoms. They can kind of start very slowly, or they can progress really rapidly, and that can be anything from difficulty speaking, paralysis, confusion. The thing is, regardless of the symptoms, it is 100%, as we said before, it's a medical emergency. Recognizing it initially is one of the most important things you can do, because time is critical to not only survival, but to the long-term recovery prognosis as well, and mitigating long-term damage. If you're curious about the causes of stroke, genetic factors, epigenetic or environmental factors, and kind of everything in between, and how to prevent them, then subscribe to my channel and don't miss out on future videos where I'll dive deeper into stroke and all things surrounding stroke and stroke recovery, unraveling the causes, origins, and most importantly, the crucial steps that you or loved ones may need on the road to recovery. Hot off the press, I came in with the guys this morning, just kind of on that note. The New England Journal of Medicine released a first ever paper yesterday that was actually showing how plastics that were found in arteries, so plaques in people's arteries, was a massive contributor to things like inflammation, and also predisposed people to stroke. So that's just one of the things on this continually evolving journey of stroke and learning along the way. So please join in, stay tuned. For now, let's dive into the life and world after stroke. And the first thing, I normally break it into four sort of distinct categories, and it's not like one ends and then the next one begins. It's almost like they build on top of each other, and then they're just in constant, almost chaos moving forward. But first is the initial shock. Anybody that's been involved in anything surrounding stroke or has had family members suffer from a stroke know that it's usually very shocking at the beginning, and it's almost a life-altering sort of trauma in many cases. The next step would be the initial medical intervention. So is there TPA given to bust a clot, medication? Is there imaging being performed? Is there a CT angiograph? Is there this? Is there an MRI? Is there surgery that's being required? Is there a shunt put in? These are all things that can be a host of tools that are at the disposal of the medical system. And it's important that these things are performed right away. And that's usually the second phase of what's happening, which then leads into the third, which is the prognosis. So what is it? Is it a hemorrhagic stroke? Is it an ischemic stroke? Where in between? What's the severity? What's the sort of like core zone of the injury? What's the penumbral area? What's the total surrounding damage? These are all things that will get thrown at family members and caregivers and loved ones ad nauseum, and they can be sort of tough to work with. And we'll try and, over the next number of videos, we'll try and work through some of this stuff. And importantly, and for today, will be, okay, now that all the amazing stuff that's done in the hospital, and it's truly miraculous a lot of times when you see where somebody comes in to then that final stage, which is discharge. And sometimes it's normal for family members or friends to be like, discharge, like Uncle Tommy can't come home right now. But oftentimes it's either to a rehabilitation facility, a specific stroke center if you're very lucky, and in other cases it's just home. So that's really what we're going to focus on here, is that patient getting home. What do we need to do, you know, in and over and above the maybe PDF form that you're given upon discharge, and then some recommendations for physio. There's a lot of things that can be done, and we're going to go through some of those drills now. Now, literally, let's roll up our sleeves and get practical. In this section, we're diving into the essential drills and exercises that can make a real difference when it comes to post-stroke recovery. First one, we're going to start with something seemingly simple. It's basically what we call our 4x4 nose breathing. And what I want you to do is, again, if you're the caregiver and you're with the patient, if you are the patient yourself, then I would like you can be lying, you can be sitting. Ideally, you're not really going to be standing, just if there's any weird changes in blood pressure, things along those lines. But what I want you to do, it's mouth closed, nose only, nice and slow, 4-second breath in with the nose, 3, 4, 4-second breath out with the nose, 1, 2, 3, 4, 4 seconds in, 2, 3, 4, 4 seconds out, 2, 3, 4. And you're going to do that for about 5 minutes, and you're doing that morning. You're doing that afternoon. You're doing that in the evening. And what that's going to do is it's just a way to get those vessels in your brain, body as well, but primarily in your brain, to be able to open up and then contract. Open up so they widen, and then they contract. And you're trying to send blood flow to all these areas. And the fascinating thing about the human brain is they're making these little rubrics. They're making these little blood flow channels to sort of help you recover. And the breathing is a great way to help do that. Second exercise is going to be something that we call sensory stim. So that second exercise, you're going to take, if anybody's got a handheld massager at home, or you can buy one on Amazon for relatively cheap. You can use an electric toothbrush. You can use basically anything else with some vibrational abilities. And again, this is something that you're going to be doing on the affected limb or the affected side, 5 minutes each area. So say somebody has a total paralysis on a certain hemisphericity. So the right side isn't moving well, if at all. So you would start, again, you may need a caregiver. If you yourself can do it, okay. And basically it's just 5 minutes up and down, sensory stimulation. On the arm, upper extremity, 5 minutes, up and down. Sensory activation is a great way to wake up the nerves, a great way to wake up what's called the sensory cortex. And that sensory cortex is what actually then gives all the foundation for the motor stuff that you need on the way out. So you can remyelinate. Myelin is this little stuff that wraps around the nerves, and it's really important for how nerves function. And sensory stimulation is a great way to target that myelin. So we go 5 minutes, then you can go 5 minutes through the trunk, you can go 5 minutes on the limb. And that would just be an example. If it was just the paralysis of the left arm, then again, 5 minutes on that left arm. But the important thing is the consistency. So 5 minutes, but you're doing that morning, you're doing that afternoon, and you're doing that evening, okay? Third one, something a little bit different, that's gonna be our mirror therapy, and we'll see you in a second. The third exercise is our mirror therapy. So something that is kind of miraculous, because what it does is it actually tricks your brain into recovering. It tricks your brain into restoring function in a limb that has been compromised due to the injuries of stroke. So this is basically how we're going to do it. You do need a mirror. Again, it doesn't have to be a particular type of mirror, whether it's, again, something that you're just grabbing literally like we did off the wall, grabbing it online. It doesn't really matter. As long as you have the ability to have a mirror set up. This example is now going to be for the upper extremity. And this is actually for, funny enough, my left hand is right here. My right hand, which would be the injured limb, my right hand is behind the mirror, okay? So the injured side or the injured limb, whether it's the leg, whether it's the arm, whether it's the trunk, the injured side is behind the mirror, okay? So then when I put my hand down, okay, and I'm looking into the mirror, it looks like my right hand, but it's actually my nice, well-working left hand, okay? And then what we're gonna do in this example is we're gonna start really super slow, because you can actually overwhelm your brain with this type of therapy. And what I'd want you to do with the upper body as an example is you're just gonna close the hand, you're gonna open, close, open. And you're gonna do that 10 times or so, okay? You're gonna do that 10 times, and then you're gonna rest. You can look away, you can close your eyes, you can just kind of move your gaze. You're gonna do it 10 times, and then you're gonna do another set, okay? So you're doing 2 sets of 10. Same thing, you're looking there, and by looking in the mirror, you're actually tricking your brain into thinking that your well-moving left hand is actually your right hand. You can then play around with this a little bit, okay? So let's say, okay, now I've done that 2 sets of 10. You can also add, sometimes initially, a little flip drill. So now it may just be over and back, over and back. 2 sets, 10 repetitions or so, and you go from there, okay? And then there's a whole series of progressions that we can build in, a whole series that we've developed over a decade or so that can be super helpful, but it's important to just start there. Consistency is key again. So you're gonna go morning, noon, and night with the mirror therapy as well. The 4th drill is actually, funny enough, you're returning to the first drill. And no, I'm not having a stroke as we speak right now. It's that important to do the nose breathing. So we used to do it where it was just, oh, okay, we did it at the beginning of a session, and then we'd repeat the session, or they would repeat the drill at home. And to be honest, over years, we just figured that it actually wasn't enough. It was such a valuable drill. It was so important to help balance out the nervous system again, so important to help drive blood flow to critically important areas, to help develop those little rubrics that we were talking about before. So we actually double it up in the rehab session itself. So when it's like, oh, you want me to do another 5 minutes at the end? That's exactly what we want you to do. So now you've got 5 minutes, you've done your other couple drills. 4th drill goes back to that nose breathing again. Mouth is closed, in for 4, out for 4, another 5 minutes. So if we're adding it up, you've got 10 minutes of it in the morning, you've got 10 minutes of it in the afternoon, and you've got 10 minutes of it in the evening. And that's your 4th drill. And a fifth drill that even the team didn't know I was throwing in today. The 5th drill, which I call the pen drill, is a drill that you or whoever's been watching this video has already started. It's basically an attentional gaze mechanism. So it's a weird, funny trick that we all have in our brains. It's like when you have an object in your hand, your eyes are going to be drawn to it. So by me holding this pen today on the left side, sometimes on the right side, moving it here, moving it there, you're actually having to use your eyes to follow around while we're talking at the same time. So lucky enough, your drills have already begun. You've got your 5 drills there, so let's get going. Okay, so to summarize the drills, you're starting with your 4x4 breathing. You're doing that for 5 minutes, and you're doing that morning, afternoon, and evening. The second drill, you're going into the sensory stim. You're grabbing that electric toothbrush, grabbing that massager, and then what you're doing is about 5 minutes on that affected limb. So it can be upper limb, it can be lower limb, 5 minutes each. And you're going morning, afternoon, evening, okay? Third is gonna be the lovely mirror. In the mirror, you're gonna go easy with it to start. 2 sets, 10 repetitions or so. You can play open, close. You can play over and back. Normally, I'd say like 2 different positions or 2 different movements. And you're doing 2 sets, 10 repetitions of each. Morning, afternoon, evening. The fourth drill, as you know, we're circling back to the first drill again. So same thing, 4x4 breathing for 5 minutes, morning, afternoon, and evening. And then you don't have to worry about the pen drill so much. But a couple things that I can tell you maybe you do worry about, or you will worry about, or your wife, husband, parents, children may worry about, are some of the things that we get thrown at us all the time. And that would be, well, maybe the drills aren't feeling particularly good. Maybe it hurts. I can actually, if I'm moving my left hand and I'm looking into the mirror, but maybe my right hand actually starts hurting a little bit, and that's something common. Or I'm doing the breathing drills, but I'm feeling a little bit lightheaded. And generally speaking, and while this is not a medical diagnosis intervention at this point, but generally speaking, we would like to encourage people to keep going. The caveat to that would be, okay, if the person that you're working with, if you're the caregiver, if they're just super fatigued, they're not able to do the drill, they become overtly nauseous, their blood pressure is going through the roof, or things along those lines, then yes, at that point you can stop. But if it's for general feelings of like being uncomfortable, unfortunately, that's a lot of the initial stages of what stroke is going to look like for people. On the flip side of that, one of the things that we sometimes deal with even more so than that would be, how hard can I push Uncle Tom over here? Uncle Tom seems to be doing okay with the rehabilitation drills. How far can we progress it? And that often goes into even the other drills that they're doing, whether at rehab or a facility or whatever the case may be. And while that's great, and it's great to have that mindset, and you can kind of push it a little bit. You want to increase volume, you know, we normally would say a few percent, 5% a week, then okay. If you want to increase the repetitions or the frequency, you can do that in small amounts as well. The one thing, the caveat to that would be, it is easy to somewhat overwhelm the metabolics of the brain, the energy system of the brain. So if you notice massive increases in level of fatigue, consciousness states where they're now not awake so much anymore, or things along those lines, a tetanus, a resting sort of tremor that wasn't there before. Like, these are indications that you could be kind of pushing it too far. So while it's okay to maybe do more, I would say that it really has to be done with caution. And you can always check back with your physicians, check back with your rehab professionals to see where they're at in terms of the scheme of things, because yes, you want to be able to progress, but it can't be too much too quickly, especially when it comes to something like stroke. If you found these insights valuable, the practical, rolled up your sleeves, full potential from a rehabilitation from stroke perspective, then hit that subscribe button and stay tuned for future videos.